uh, panel over there on the side, but we've got that taken care of. So I want to welcome everyone tonight. This is our third webinar. My name is Ed Melandro. I am the Borough Administrator. Again, in trying to update everyone, we thought it would be a good idea to have another one not too much longer after the last one we had. I think this one has a whole lot better news than the last time out. I'm going to introduce the panel in a second, and then we're going to get a quick overview. Since this is our third time, we're not going to go into a lot of detail on what everyone does, but rather everyone will just give a brief update, and then we'll take it for questions. We do know that we have the presidential debate on at 8 o'clock, I believe, so we'll get moving on this. So today on our panel, we have Mayor Wallace. We have Jack Manning, the OEM coordinator for the Borough of Glassboro. We have Chief John Polillo. We have Joanne Connor, President's Chief of Staff, Tony Lohman, Provost, Scott Woodside, Director of the Wellness Center. We have Kevin Cohen, Dean of Students, Mike Kantner, AVP for Public Safety, and Monica Shealy, Senior Vice President for Diversity, Equity, and Inclusion. At this point, I'd like to turn it over to Mayor John Wallace for some initial comments. John?
Thank you, Ed. Good evening, everyone. And I'd like to welcome and thank everyone for attending this, our third installment of the Glassboro Rowan virtual seminar to discuss the community issues that are related to the ongoing pandemic with regard to the reopening of Rowan University and how the borough and university are handling this pandemic. I'd like to thank Joanne Connor, and Ed Melandro and all of the members on this panel of the Glassboro and Rowan leadership for taking time out to share their expertise and what they have done in their respective areas with regard to the health and safety of our residents and students. And with that, I'll turn it back over to Ed. Thank you.
Thanks, John. At this point, Jack Manning, the OEM coordinator for the Borough of Glassboro, will give a much better update on our numbers than what we had a couple of weeks ago. Jack?
Yeah, we've seen significant improvement. The day after our webinar last week, we had one big day, a spike day. It was the largest we've had. It was considerable, and it did concern us a little bit. But then from that day forward, we started to drop down to back to close to what we consider relatively normal numbers as far as we're concerned. So on the 17th of last week, we had a total of 473 cases in the borough, and our 14-day number was 218 because of that 48 spike. And then our today we're at 541, which is still a big number, but it's not it didn't grow as much as we had expected, and we're down to 136 on our 14-day window. So that's a difference of 82 positive tests in 1 week. We're down. So they're good numbers, and at the rate we're going, if we average 1 or 2 a day, we'll be dropping down to the low numbers, the single-digit numbers around the 13th or 14th of October. We'll be back down to single-digit numbers for our 14-day window. And just one last one, the average ages we were looking at from the first of this month to our last meeting was 27. Was the average age in Glassboro, and 45 for the county. And for from the 18th to the 29th, the average age of positive tests is 34. So we've come up with that. So it seems like the college age positive tests are coming down, and we're seeing more normal, more consistent test numbers than with the rest of the county. So within a couple of weeks, we'll probably be back down to 0 and 1 days like we were before the beginning of this month. So it's positive. It looks good. I know the number looks big right now, but again, those 14-day window numbers are going to drop by significant amounts every single day we move forward. That's it for me.
Thank you, Jack. And again, much better news than about a week and a half ago. At this point, Tony Lohman, Provost. Tony?
Yeah, thank you. Thank you for the positive news, Jack. I know we're happy to see this in the right direction as well. Obviously, from us being here again, we care very deeply about about this and making sure that that all goes well and that we keep everybody safe. I'm not going to spend too much time here because you've heard me before. For a lot of people who are back, I'll leave it to the folks who are on the ground doing the daily testing and monitoring the parties and the student activities that raise the concerns. Well, again, we're operating in a hybrid type format with a significant reduction on our on-campus population. It seems to be going well. Our on-campus populations are doing the right things, wearing masks, being responsible. So we're very happy with the direction things are going. This week we did start to bump back up some of our in-person instruction, and we'll see a continued small increase in that this week as well as next week, at which point we'll hit our what I would call our steady state operation. We'll still have no more than about 30% of our classes having a face-to-face content. But again, we're comfortable with those types of activities because that's where the students are exhibiting the responsibility, and we feel pretty good about that. As always, we're going to monitor the data every day and watch how this goes. We know that we're not out of the woods. We're ready to take a step back at any time if we need to, and certainly we're staying on top of everything, and we're partnering with the county and the borough to make sure that everything's going in the right direction. So thanks for joining us tonight.
Thanks, Tony. I just want to mention, if anyone has any questions, there is a Q&A. You can write your question in, and we will do our best to get to it. At this point, Scott Woodside. Scott, if you give us a quick update, that would be great.
Yep. Thank you. It'll be very brief. So as Jack had mentioned, we're very happy about the numbers, but we're not satisfied. Of course, we're going to stay vigilant. So know that's my big message. We did open up a pandemic operations center during the peak of the spike in cases, and I'm happy to report that we decommissioned that as we are seeing a significant decrease in positive cases. We're coupling that with a significant increase in our testing. So we are not only testing more contacts and more students, we're also increasing our asymptomatic testing. I actually just got the notification. We just did 100 tests tonight of asymptomatic contacts, just to keep an eye on that, knowing that in this population, asymptomatic spread is probably more common than symptomatic spread, to be honest. So we're being increasingly vigilant on that. I can tell you, and Kevin will probably speak to this as well, the number in our isolation facility on campus is down to 4 students, where it was significantly higher than that during the peak. So we're very optimistic, but we're going to remain vigilant. And I can't wait to answer some questions that come up, and very grateful for everybody on this panel as well.
Thank you. Much appreciated, Scott. And lastly, we have Kevin Cohen. Kevin, if you could give us a quick update, that would be great.
Yes, good evening. Thank you all for being here. Thanks for the opportunity to speak with you this evening. I appreciate it. As Scott said, we have 4 students that are in isolation housing, and that's a number that we will continue to see go down as those students are eligible to be leaving that isolation housing very soon. A lot of our effort, as Scott said, we closed the control center, but we're prepared to open that if we need to in the future. But a lot of my effort now is to continue to monitor the concerns that are coming in and responding to those. Thanks to everybody who continues to report their concerns and share their thoughts with us. That's important. And we're responding to those and holding students accountable, both student groups and students as individuals. Now, just like Tony was talking about with classes, we look at we're going to do this very smartly. We're not just going to jump into things, but can we start to open up some recreation opportunities? Can we start to open up some dining opportunities and athletics? So we're starting to have those conversations, start to prepare for that, and we'll do that in the right way. So thank you, and I'm prepared to answer any questions that you might have.
Thank you. So we have our first question. We'll dive right into it. Reduced number of new positive cases. How does this compare to the number of tests administered that resulted in the spike?
Well, so I would say our students have the benefit of having access to numerous testing resources. So not only did we offer testing on campus, our partners that are at Inspire Urgent Care, AFC Urgent Care, Rite Aid, CVS, they significantly offer testing as well. So there's no shortage of tests for our students. And as a result, many people are misinformed about when and how often they should be tested. So we have numerous students going even multiple times to get tested. So we know that we we have a large number. We had a large number of people that did receive positive results, and we acted accordingly. But I think the key now is not necessarily the looking at those numbers and those positive numbers or the historical numbers. It's how are we staying vigilant with assessing for asymptomatic spread, which I think is the biggest threat in this population. So we're going to be that continuously and making sure that we have testing available to students on campus. And, our partners will stay in close contact with them. They've been amazing through this and really helped us in assessing where we are.
Thanks, Scott. We have another question. It's a bunch of questions, actually. As a homeowner and taxpayer in Glassboro, I'm extremely concerned about the reported surge in cases of COVID-19 in Glassboro and the comments in recent news reports. Just what we don't need in our town. Over 250 cases, and the university says so far officials say they feel very comfortable with the current number of cases. So it seems like it was a little while ago. Question one, who is sweeping the outbreak under the carpet? I don't think we are, but I will present that to Rowan or Jack Manning. If anyone would like to address the question, who is sweeping the outbreak under the carpet? I think we've been more than forthcoming in presenting the information, and we actually had a meeting, as I mentioned, a week and a half at the height of our outbreak. So, but if anyone from Rowan would like to take that, I'd be more than glad to listen.
I mean, I could go ahead. Do you want me to go, John?
Yeah, so I'm going to let you piggyback off of it, but I just want to say that, again, that the president has tasked us with ensuring that we're working side by side with the borough to make sure that we are providing all of the information that is needed. So we certainly have no intention of sweeping anything under the rug. And in fact, we have been incredibly forthcoming, not just with our data, but also just in information and answering questions. And our plan is to continue to do exactly that. And so we're happy to answer all of the questions that individuals have because we know that this is something that is very scary for all of us.
Yeah, I think transparency's been key, and I think we've been posting numbers. And as we mentioned about the numbers before, the numbers that we post at Rowan is actually pretty aggressive because we are vigilant in having our faculty, our students, our staff report to us and any known positives, and we investigate. So once we have them, we post them. Not only that, I'm on a conference call every day with the health department. So there really is no lack of communication with the health officials, with Rowan, with Glassboro, in terms of sharing that information.
Yeah, and I want to share, having sat in the control center with Scott for the last 3 weeks, I think that's an important piece that we're actively seeking out information. We're trying to get data to be given to us so that we can be transparent. So I would agree. I don't think anything's being swept under the rug, and we're being assertive and we're trying to be at the forefront of getting that data so that we can share it.
And if I may, from the borough side, and thank you everyone that weighed in on that question. I am confident that all of the officials in Glassboro and all involved in Glassboro and with Rowan and their administration as well are going, in my opinion, well, I can't say above and beyond, but we are absolutely doing everything that we possibly think that we could do to keep everyone safe, residents and students alike. And in addition to doing that, we are constantly, like everyone that spoke before me said, staying abreast of all of the most current information and communicating with each other on a daily basis to make sure that we are all on the same page, because we all realize how important this is to all of us.
And to add to that as well, Mayor, the numbers that we put out are the numbers. They come from the state and the county websites, which are public. So if we were trying to sweep something under the rug, we just wouldn't say anything and we wouldn't address anything that was going on. But we're trying to be as upfront and honest as possible, and that's what our goal has been since the beginning. We've put out messages to the public through our website, through social media, trying to keep everybody up to date. We've met with the Rowan University on a regular basis, the school district on a regular basis, neighboring municipalities on a regular basis. We're all trying to get as much information out as possible. And if we are never ever hesitant to answer any questions anybody has. If anybody has a question about numbers, ages, what we're doing, you're welcome to call my office, and we'll provide you with as much information as you need.
Thank you. The next question we have is, as a follow-up to my test question, so how many tests have been administered?
On our campus, between asymptomatic and symptomatic, it's not an exact number, but it's probably close to 400, 500, somewhere in that range. And obviously a lot more than that with off campus. So it's a very large number of students that have been tested.
And if you're asking about countywide, the county's conducted 60,000 tests since the beginning of this ordeal back in March. They don't give us those numbers by municipality, but the total for the county is 60,000. Can't tell you how many were Glassboro. We don't know that.
Thank you. Next question. Are there things the college would handle differently than the first outbreak?
I honestly, I think we were as flexible and responsive as we possibly could have been. I mean, we recognize that, much of the outbreak is, and I think I coined this term last time we were on here, was social spread. It was students that come in and they have a roommate, and the roommate was with another roommate, or they're in a house with a housemates or suite mates. It wasn't the large parties that we've seen, across the country in some of these universities. It's more the casual social spread, and that happens with students reacclimating to campus. So I think we set up isolation procedures and protocols and support protocols. So I think we did that well. Of course, everything can be done better. I'm not saying we're perfect for sure, but I think that we followed our plan as closely as we could have.
Thank you. And Scott, just to pick up on that question, I'm having a difficult time seeing the questions, but the first part of it was, with the upcoming cold and flu season, will the college take additional wellness steps?
That's a great question. And luckily, as those of you that are new to the call, I'm the former director of public health nursing, and I used to administer their flu program, giving out 20,000 shots a year for our Glassboro residents as well. We are going to be modeling some of that. We'll be working with the health department and with our community partners. We're having two very large clinics. One's going to be a drive-through. One's going to be a walk-up clinic coming up in October. We're also going to be supporting the Gloucester County Health Department with all of their flu clinics. So our Rowan nurses will be at those flu shots as well, flu clinics as well, to help administer flu shots to Glassboro and County. So we're going to be giving as much flu out as possible, and really education. We're going to continue with our education. I know our dean of students and our public relations office is going to continue to push out good messages. And I'm really hopeful that we have a mild flu season. That's what we've seen in the other hemisphere leading up to this flu season. So I'm hopeful that continues. But I'm not saying don't get a flu shot. I think everybody on this call should get a flu shot.
Thank you. This question is, I'm concerned with the delay in the students are experiencing in learning. For example, chemistry lab, when they are participating by remote learning. Will this delay future learning classes?
I'll take that. I guess that's me. So some of our, most all of our labs are actually offered in a face-to-face environment, with lectures being hybrid. So no, we don't feel like there'll be problems with learning going forward. I think having the experience of the spring has helped us improve what we were doing in the online offering. So we feel pretty good about the learning modalities. Obviously, we would prefer to have no COVID and be back to face in a much broader fashion, but we're doing the best with what we have. But thinking more broadly about all of our classes across the curriculum, and we're working with our accrediting bodies for all of our disciplines to try to look what are the needs, what are the gaps we might see because of online learning, and how can we bridge those gaps in the future years and spread it out over students' education. But things like chemistry that are lab-based, those classes are offering almost fully in a face-to-face fashion.
Thank you. Next question. Is it possible to add test administered to the online Rowan COVID update?
Sorry, I muted myself. So we're constantly updating our dashboard, and we actually have a metrics team that meets 3 times a week, but informally 5 times a week. If you've been paying attention to our dashboard, we have added significant information to there during the course of the semester. We did add our asymptomatic testing information, so that's on there. We'll continue to look and see if we should add others, but I really think I can't answer the question how many tests were administered to give you a rate. I can tell you, like I said, we've administered probably around 500 tests on campus, and the number off campus I won't be able to gather because it's from multiple different sources. So I couldn't give you a positivity rate based on all that. Just trying to be transparent and answer the question. But it's a large number of tests that were administered on and off campus relative to the positive cases.
Thank you. Believe it or not, I'm trying to do my best to see all the questions. I think I've asked them all at this point.
And there was a question about somebody seeing somebody not wearing a mask.
Oh, you're right. I'm sorry.
And I think that's an important dialogue to have. That certainly, from a university standpoint, we have all done lots of educational programming activities, et cetera, to help our students, faculty, and staff understand the importance of wearing a mask at all times. But I think it is important to note that if people are outside, they're not required to wear a mask. And I think that's an important piece. We certainly want our students to wear them. We want our faculty and staff to wear them. But you might see people walking outside. You might see, if I'm walking with somebody that lives in my household, we're not required to wear a mask. There's no significant risk to not wearing a mask if we're considered to be in the same household. So I think it's important to know that we are educating people. We want them to wear masks, but you might see people out in public not wearing them.
Thank you.
And one of the questions, I just in case, I read it a little bit differently than I think that we responded regarding what would we do differently if there was another increase in cases. And I just wanted to share that the plan that we have developed and that we've been operationalizing is one that allows us to, as people are making fun of me for saying, ebb and flow with the data. And so we are looking at the numbers constantly and allowing the data to drive our decision making. And so right now we're in the process of saying, okay, the numbers are coming down, which is good. Obviously, we would love to have 0 cases, but they're down, which is wonderful. And so now we're starting to say, what more can we add in? And we're going to test that and see how that goes. And that's how we intend to operate throughout the semester. So it's not going to, at any point in time throughout the year, be the situation where we just add in more activities and then that's it for the rest of the semester or the year. We're going to add in and we're going to be constantly assessing, and we will be reacting according to what the data shows from there. So if we allow more activities to occur, and we see that there's an increase in cases, then we're going to pull back the reins a little bit. Of course, a lot of that depends on where. If it's with a particular, sports team because they've started practicing and training, which they're permitted to do, then we would say that team should not practice or train while allowing the others. So again, we're looking at the data and where it's happening, and we are gauging our responses accordingly, all based on what we're seeing with the data. So just hopefully that answers questions, because I know we do frequently get the question about, if there was another increase, would you close down? No, not necessarily. That doesn't mean that if we had a lot of increases across the entire university that were unrelated to one another, that we wouldn't. Everything is a possibility. We're just trying to manage it and to see what we can do while also keeping people safe.
Thanks, Joanne. One other question that I have, and again, I'm having a problem seeing them. So if I'm reading, this is one from earlier though, and then it came across. How does the borough, along with the university, plan to put real safeguards in place to prevent the young students from spreading the coronavirus to Glassboro residents?
Yeah, I would say we've certainly done a number of things already. And when we're talking to the landlords, when we're educating our students ahead of time, when we were monitoring folks from out of states. And so a number of things I would say we have put in as safeguards. I don't know, again, that there's a way to get this data. I don't know that there's been a whole lot of transmission of students to community members. I think Scott talked about there kind of being that social factor of people living together in houses that might be a little bit of the transition. But I don't know that there's been a whole lot of evidence that says that there's a transmission between community to students or students to community.
I mean, I can tell you the transmission rate on campus is incredibly low. We've only identified 4 employees really since March that have been diagnosed with COVID. So we know how to do that social distance and teach that social distancing. I can also tell you that when we were in the Pandemic Operations Center, we implemented a program where we were calling every house that we had a known case in it every day, just to let them know we were monitoring, we were on it, we were giving them information, making sure they didn't have needs. Some students actually had food needs. And instead of telling them to go to the grocery store, we actually dropped off food to them. So, I mean, so all those things we put in place and we'll continue to monitor and do what we can to prevent it, because as we've all said, this is a community. This is not just a Rowan University issue. So,
and from, if I may, from the borough side, the safeguards, I think we've done everything again that we could think of that possibly to put whatever safeguards we could legally put into place. But in addition to that, again, we have been proactive. The borough, Rowan, collectively have been proactive from the onset of this. We've been prepared for it, and we are approaching it, I think, the best way that we can. The reason that we're having these webinars, the reason that we're supplying the residents and students with all of this information, reminding you to wash your hands, reminding you to wear your mask, reminding you to social distance to the best of your ability. Those, in my opinion, can be interpreted as safeguards. So again, we are, I believe, and will continue to do the best that we can to keep all informed and healthy and safe.
And again, Mayor, to add to that, like we mentioned in our last meeting, we're not really permitted to go above and beyond what the executive orders allow us to do. We can't restrict who lives in houses and how many people live in houses. We can't restrict people from going out and leaving their houses, even if they're quarantined. These quarantines are all voluntary. They're not mandated by anyone. So there's really not much we can do about people moving around and people living in homes. We can't close businesses, we can't close restaurants, we can't close schools. We are just limited on what we can do, except the best thing we can do is get the information out to people, be transparent, honest with our information, and just push the prevention and the response and make known how important it is for everyone, people who are infected and people who are not infected, to be responsible and to look out for each other. And that's the best we can do at this point. Like I said, we're limited on what we can do as far as physically to the infrastructure of the borough.
Thank you all. Scott, I think this one's for you. Can you please restate the current number of positive cases among students?
So I'm currently tracking 20 students right now that I know have a positive test within the past 10 days. Is that the number you're looking for?
I believe that's what the question stated. Yes, sir.
Yeah, down to 20. And that's significantly lower than where we were 3 weeks ago. And the reason why we opened up the operations center to manage that. So I'm happy with that trend for sure.
Thanks, Scott. And Mayor, this is really a question for you or I, either one of us. Is there any plan to reopen Rowan Boulevard to traffic this year, and what criteria might be considered?
Well, Ed, I think that you would probably be better suited at answering the question, but the answer from my mouth will be, all things are being considered, and are we planning to reopen it? If you're asking for a yes or no, I really don't have one at this point. Ed, maybe you can be a little more clear.
No, I would agree. And when we originally set out to keep Rowan, to shut Rowan Boulevard down to vehicle traffic, it was going to be a short period of time. And honestly, it's been so well received that right now, to the mayor's point, we're not sure if we have a date when we will reopen it. We need to further investigate it. And again, it's been nothing but positive responses about closing it and creating more of a walking environment downtown. And that's where we are right now with it. So, I was able to get I think I was able to get my questions fixed. I think one more just came in. Let me see if I can grab it. Yep. The two more. Are there any provisions being taken when students return from Thanksgiving?
Yeah, I'll let Tony talk from an academic side, but from a student life side, that's something we've been discussing a lot recently. Certainly, we know that we will be paying attention to those students who are from quarantine states, as listed by New Jersey. We know that there'll be some students who can't go home and will need to stay. So we are taking measures to make sure there are activities, make sure there's food, make sure there are opportunities for those students who need to stay, but also working with the students for when they come back and what they'll need to do.
So I'll follow up to Kevin. So yes, we're looking at students, particularly those going out of state, the hot spots, trying to keep them on campus and try to provide them opportunities for some type of Thanksgiving while on campus in some activities. We're also going to be as Stan said, with our ebb and flow, we'll take a very hard look at what do things look like going into Thanksgiving? What do things look like over Thanksgiving? And if we need to roll things back the weeks we would be coming back between finals, we will. So we'll be paying very close attention to the data, really as we start to get into late October and early November, when public health is telling us you should start to see resurgences. So we don't, other than the out-of-state students for now, we don't have any definitive plans. We're just going to watch and see and respond to what best practices dictate.
Thank you. That's all the questions that I am seeing right now. I've left out the positive ones, but I'd like to let the panelists know that we do have some positive comments, and we appreciate that. And that this time, that's all. I'm just going to do one more check to make sure I'm not saying any more. No, I'm not. So again, I'd like to thank all of our panelists. I'd like to thank Rowan University. Again, if we do see numbers change, we will be right back at it. The one thing I want to say, Rowan has been extremely responsive. This is our third webinar. I'm sure there's going to be others. With the positive numbers, positive trends, we thought about canceling it, this one, but we thought it was important to bring everyone up to speed and let you know what we will be doing. And we will continue to do that. And at this point, I'd like to turn it over to Joanne Connor and then the mayor for any final comments.
Well, on behalf of the university and on behalf of the president, we just want to thank all of you, the administration of the borough, for working so closely with us. We obviously cannot do this without you. And so we're so grateful for your partnership and for the united front that we're able to present to the entire community. And we just want to thank the residents as well, and hope that you know how much the president cares about each and every resident of Glassboro and in the neighboring communities, and that he has tasked each of us with ensuring that we take every step possible to make sure that everyone stays safe. So we thank you, and we look forward to continuing to working with everybody to manage this to the best of our ability. So thank you very much.
All right, thank you, Joanne. And again, to all the panelists, it really makes me feel good that we have this contingency of panelists that are taking the time and care so much about the residents and students to keep them informed with what's going on. They're very trying times for all of us, and we understand. And please, to all the residents and students out there, please know, and we're all trying to convey this, that we are working diligently day and night to make sure that you are all safe and taken care of to the best of our ability, because that's what we were put here to do. Again, to all the people that ask questions, thank you for being engaging. Thank you for asking us questions. It keeps us thinking as well. And please don't hesitate to continue to reach out. I'm sure we may be having another webinar in the near future. So we look forward to having that other one again. And everyone, just please be safe, be healthy, and practice hand washing, social distancing, and wear masks whenever possible. Thank you.
Thanks, John. And I hate to be a party pooper, but we did get another question in, and we're still within time. I'm sorry, but we've been ultra transparent with this, and I don't want to stop now. Are kids in the quarantine dorm supervised at all? How do they get fed?
Yeah, I think that's a great question, and yes, I want to compliment our residential living team. They have done an amazing job. So anytime somebody has the opportunity to move to isolated or to our isolation housing, one, we assist them with transportation if they need it to and from. We have multiple staff members, be it somebody from the wellness center, be it somebody from our residential learning team. I call them as well. We have regular contact, 4, 5, 6, multiple times a day. We're contacting those students. So there is supervision through the on-call staff, through student staff that we have. As far as feeding our students, I think we do a really good job of that. In fact, we created a specialized program where our students can order their food in a special way differently from other students on campus. So we're paying attention to dietary needs. We're paying attention to the uniqueness of what they have and what they need. So we're also, Scott has gone over there personally. I've gone over there. Other members of the team have gone over there to do activities, programs. So we are taking care of those students from a holistic standpoint, not just making sure that they have a place to lay their head, but looking at the food, their activities, etc. So I'm pretty proud of what we're doing in that area. The other thing I would like to take the liberty, I certainly appreciate that Glassboro is sending us compliments, but I do want to say that the Glassboro team has been amazing, reaching out to us, communicating with us, talking with me, talking with others. So please, Glassboro, I want to share my sincere appreciation on a personal level from the police, from the mayor's office, from the administrator's office. You all have been amazing, and I really appreciate the collaboration and communication that we've had. It means the world to me.
Okay, well, I think that's hold on, let me make sure. Yep, let me just check. Might have gotten one more in. And again, no, we're good. We got to thank you. So just wanted to make sure we addressed it. So again, we will be back in contact. So if we didn't get to, I think we got to all the questions, but if there's still a question you want to answer, you can reach out to any one of us. You can get our emails at any time, and we will promise to get back to you. So thank you, everyone. I hope everyone has a great evening.
Have a good night. Thank you.
Good night, everyone. Thank you again.
Okay.